Schizophrenia is a psychotic disorder and affects a significant number of people. It affects 4 million Americans, and every 1 out of 9 people have either schizophrenia or a schizoid personality disorder. The people usually in schizophrenia, there is positive symptoms and negative symptoms. Positive symptoms are hallucinations, auditory, visual, mostly auditory. The patient will hear voices. There will be thought insertion, thought broadcasting, there will be delusions and paranoia sometimes, and the person will not be very functional in a schizophrenia because relationships they get disturbed and they cannot think straight. The negative symptoms are anhedonia, catatonia, kind of a flat affect, slow affect, and they are unable to keep a proper relationship because of all these symptoms. Now there is a different kind of modalities have been developed to address schizophrenia, ranging from medication to behavior therapy and CBT. Medications, there are typical and atypical antipsychotics. Initially, in the earlier times, chlorpromazine was used, but due to various side effects, it went out of vogue, and now there are typical and atypical antipsychotics. Atypical being quetiapine, olanzapine, risperidone, piprasidone, and the likes. Risperidone and can have affect Parkinson-like effects and also can cause galactorrhea. I have seen galactorrhea developing primarily and in patients on risperidone, and even after cessation of risperidone it continued for a few months. This is very important. All these things have to be taken in effect. Olanzapine can cause weight gain because of appetite stimulation, and that so much weight gain a person can become obese and also can become a diabetic. Schizophrenia should be treated, especially these things should be known in the third world. People should not be discounted. Awareness has to be created, and psychiatric problems should not be shelved and shunned. Our society and family shuns psychotic people, and they are not treated, and many of times they are very badly abused and beaten, especially women, and this is a big crime. All these things should stop. We need to have grassroots awareness, and we need to even educate our family practitioners and general practitioners about psychiatric disorders, depression, schizophrenia, and the likes. Depression can accompany schizophrenia, and when both of these things occur together, then they can be labeled as schizoaffective disorders. These disorders are readily treated, and there are long-acting medication also available now for these problems, like flufenazine, slow release injections like flufenazine deconate. So these things can now readily be controlled, and especially if there is a proper team, internist, psychiatrist, behavior therapist, psychotherapist, psychologist. It needs a complete team, a social worker, and these things should be addressed. This is imperative we address these issues as part of humanity, especially in our part of the third world, so people become functional and live a gainful life and should not be lost, and things should not fall through the cracks. My name is Dr. Munir Hussain Faswala. My mobile number is 00923002502669. In Pakistan is 00 21438 3964 and also 0300 2502 669. I sit at Samrose Hospital and Karachi Medical Complex in Gulshan.